Hello, beautifuls. Welcome back to my Chanel. And a glorious welcome back to my co-host, Mr. Biscuits. Oh, thank you for the little kiss. Yes, how are you doing, baby?
I can't wait to get plastic surgery.
Mr. Biscuit is feeling exceptionally cuddly today. And you know what? I'm going to fully indulge that. You can stay on my lap as long as you want, Mr. Biscuits. To the complete shock of perhaps no one at all, actually. The last episode of Botched here on the Chanel, my loves, the first one, in fact, did exceptionally well. And you guys have been asking me to continue the series. So, welcome back to Botched, my loves.
Time for a brow lift.
Today we are watching an episode called Vagina Bomb. I mean, that is, I suppose, the more technical term to pussy pop.
Bitch, why you mad? Cause my pussy pops severely and yours don't?
Isn't that right, Mr. Biscuit?
Yeah, my pussy's popping.
You don't have one yet, Mr. Biscuit, my transsexual dog.
Oh, scandalous.
I'm also still severely surprised that the last episode featured Janice Dickinson. We just can't get away from her. She's everywhere, girls. With that being said, do you want a top comment from the last episode? I think I do. And this is by My Queer Plant Family. No. And they say, I'm a defense attorney, and I can tell you from personal experience, and research backs it up, that hungry judges are harsher on their defendants. You don't want to have your case right before lunch, or worse, past the judge's lunch break time. It's scary when your fate can be impacted by an off day, hungry tummy, or a tired mind. Quite. This is in response to the fact that if you get a procedure done on a Friday afternoon, you are more likely to require a revision surgery than if you were to get it on Monday morning. Surgeons get tired too, Biscuit. I do find it funny that no matter how hard we try to erase human nature, it will still be here, girls. People get tired. People get grumpy. It's just what happens. It's human. So, my lovelies, I have no idea what to expect from this episode. The fact that it's called Vagina Bomb makes me feel like we're probably going to be seeing some nether regions here on the Chanel. So make sure you're sitting comfortably. Grab yourself a beverage. Pop your little hanger right into your little botched hole. And let's watch Botched, girls.
Hello, whose pussy is this?
I want to be perfect. I want to be MySpace. I want to be plastic, girls. Eyelashes and plastic. Knives. Gouts. Oh dear. No. Oh, perfect. I still can't get over how MySpace that is. I kind of love it. It harkens back to a time when I was like a literal teenager on the internet being like, oh my god, MySpace. Love it, love it, love it. Who remembers Jeffrey Paris?
I really want to lose 3 pounds. Take off your makeup.
Right, here we go, girls. We're on the pier. On the pier and on the game. Oh, what? Yeah, a buttock. Yeah. Oh, she's on the go.
Kimber James.
Imagine. Oh, is she a doll? Imagine rollerblading in just a bikini. I feel like this is asking for, like, death injuries. Right, here we go.
I'm Kimber James.
Kimber James.
By the age of 23, I had 24 plastic surgeries.
Oh, 24 plastic surgeries.
I had 2 brow lifts, 2 brow bone shavings,
brow lifts.
hairline reduction, 4
Oh, yes.
rhinoplasties,
Right.
my ears pinned back,
Right.
an upper lip lift, a
Yes.
lower lip reduction,
Yes.
a jaw reduction, chin shaved down twice, lower neck lift, neck lipo, a tracheal shave, 5 breast surgeries. 3 were augmentations, 2 were corrective. I
Oh,
definitely look back and think I really shouldn't have done a lot of the surgeries I've done, but
So, oh goodness me, boobies, girl. The fact of the matter is, when you are trans, quite often all the time, not all the time, quite often, if you are trans and you decide to medically transition, that sometimes involves plastic surgery. And unfortunately, sometimes those things may need revisions as well. Do you know what though? I have a very odd feeling about like trans people going on these shows like Botched, because transsexual women are kind of the backbone of these shows being shocking, because sometimes the amount of work that's like, I'm gonna use the word needed here, to transition from male to female is a lot of work. So of course, compared to perhaps a cis person who's just like, I want a nose job actually, just a nose job. Of course, we're gonna see like more extreme examples of plastic surgery. The backbone of the plastic surgery industry, my lovelies, transsexuals.
I just probably went a bit too far.
A bit too far? Well, at least she
started
knows.
with breast augmentations when I was
Right.
17.
17?
I had issues every single time.
Oh, no.
And now I'm just Ripple
Oh,
Central.
Ripley.
Everyone knows I've had a nose job the minute they look at my face.
You just look expensive.
But I want to look natural.
Is that possible?
You want to look natural?
At 15, I had my first nose job, totally botched.
15?
And now I've
15 years old? No! Who's doing nose jobs on 15-year-olds? My seat has become exceptionally uncomfortable at the concept of going plastic surgery at 15. Cosmetic as well.
had 3 more to correct it, and I'm still
3
not
more
happy.
nose jobs.
And it's
So 4 nose
not
jobs.
just because
Oh,
I'm not
goodness.
satisfied. It's a mess. I've had to take cartilage from both ears to repair. I can't really breathe that well. It's why I sound so nasal. I hate when people make nasty comments. I'm over it. I feel like I'm just a walking mistake. I want to be more natural. I want to be more toned down. I want to feel more like a woman and look more like a woman.
You look expensive.
Oh, relatable. I didn't think today was going to be quite this kind of an episode, but she definitely has a very LA doll vibe, shall we say. Plastic surgery, transsexual from LA, an LA doll. Right. Did you look
I
expensive?
had my sex change a year and a half ago. I told him I wanted to look like I was 13 and never been touched before. My
Okay,
vagina
problematic.
looked like a baseball glove. I was the first.
I'm sorry.
My vagina looks like a baseball glove. I was the first transsexual to sign with an adult agency, but I'm really at the point now where I'm working my way out of porn. It's time for me to move on.
Sex work and being trans is one of those things that just happens to go hand in hand quite often, because being trans is very, very expensive, and quite often due to economic discrimination, shall we say. Trans people back then, and maybe even before when this was filmed, when was this, 2014, were discriminated against in the workplace and therefore quite often not allowed to work like what we would deem regular jobs. And what's the fastest way to earn a lot of money to keep up a medically expensive lifestyle? Big titty lady videos on the internet. Sex work. The comment, however, that her nether regions resemble a baseball glove is a little bit, I don't know. I don't quite know. Am I gonna see lots of vagina in this episode? Probably.
I feel like the doctor gave me no inner lip. He only gave me outer, and the outer lips are not tight. They hang too low. It doesn't look like a vagina to me. I really feel like once this is done, no more plastic surgery.
I'm really hoping so.
I just want to meet a nice, normal guy, have the white picket fence, but I don't necessarily think it will really happen for me.
So I do want to say, though, that your vibe attracts your tribe. As much as, like, my little doll part of my brain is like, get everything you want. I am also like, if you want a very traditional relationship, you kind of have to have quite traditional values, I guess. Those sorts of things generally go hand in hand. But who wants tradition anyway? Not me.
I think I come with a lot of baggage.
Right. A lot of baggage? Well, relatable. Only gets more the older you get.
Who is a transgender from male to female. She needs a revision of her nose, which is...
A transgender? A transgender? No. One of them transgenders?
She's had multiple surgeries.
Right.
I'm gonna
Hello,
do,
Dr. Paul.
with your help, a revision of her breasts.
This is one in the middle.
And then she looks like she has a complicated
Dr. Gary.
vaginal labial reconstructive.
Oh dear. Okay,
need,
right. Labia.
Right?
Correct.
Yeah.
Fallopian
in a very
tube, labia.
complicated case like this, we need to bring in a world's expert. Dr. Alter basically is the wizard of vaginas. He's a vagina whisperer. When you undergo...
We're getting quite complicated today, my lovelies. All these new technical terms. Vagina whisperer?
Hello.
Vagina?
transgender male to female surgery, do you have to learn how to fake an orgasm the way my wife does?
Terry has a subtle penis syndrome.
That's better than micro penis syndrome like you have.
I don't think that has anything to do with you. Or am I going to be like viciously upset about today's episode, my lovelies? Oh my goodness me. Okay, so what do we think about that interaction there? Do you think it's appropriate for Dr. Dubrow to say,
Do you have to fake an orgasm like my wife? Do you have to learn to fake it?
no, because a good surgeon will not disrupt your ability to have an orgasm during gender confirmation surgery. Hello, Kimberly.
Hi, Kimber.
Hi. How are
Kimberly.
Terry Dubrow, nice to meet you. I'm not familiar with Kimber James's work. I bet you Paul is.
This is Dr. Alter.
Nice
to meet
Dr.
you.
Alter.
Who's this young lady?
This is my best friend, Danielle.
Hello, Danielle.
So we've been talking about you behind your back, obviously, in a positive way. And we've been talking about all 3 different types of surgeries, from the nose to the breast and then down in the vaginal region.
So she's having full body work done. She's having a lot of like reconstructive work, which is a lot to go through all at once. I hope they do stagger them somehow over a period of time, because if you're having breast work done, you can't really like move your arms very much. And if you have to like deal with like sensitive nose, I mean, I guess you could probably have nose and breasts done at the same time, because your nose doesn't require a lot of like immediate upkeep and lots of like doing all this. Whereas if you have anything done to your nether regions, whilst you also can't really move or pick up anything or bend in specific angles because your breasts are healing, it's just not the vibe, is it, sis? It's not the vibe.
Cancelled!
Start off with your breasts.
Well, I've had 5 surgeries. Now I'm 1,000 cc's.
1,000 cc's is like 2 quarts of milk, right?
That's
I pay
gigantic.
every day for it.
So now you feel you're too big.
Yeah, I mean, like, I'd like to go
1,000
down to like
cc's is a lot.
800.
Right.
When we get a patient that has had many plastic surgeries and gone to the extreme, it's usually a red flag for us.
Yes.
But in Kimber's case, she's asking us to make her look more natural.
Yes.
So that's something we're okay with.
Yes, okay, I'm glad that he phrased it like that and wasn't just like, this crazy
Lovely woman.
because I always expect these TV shows to go down that route. Right, okay.
What's going on with your nose?
It just looks very
Artificial.
nose jobby. It looks like it's a fake nose.
When
She
you
wants it to
overdo a
look
nose
more
and take out too much tip cartilage, the tip starts to shorten and lift back, it loses projection, and the nostrils get really retracted or pulled back. This is a sign of
She needs to name and shame her surgeons, I think. Name and shame them.
aggressive surgery. But now for our final part.
Vagina.
So
Wouldn't vagina? Wouldn't filler actually be a better option now if you wanted to extend the nose to make it look more natural, more sleek, more? I guess she's going for that like Eurocentric nose. I don't know. We'll have to wait and see about that. Yes, right. Okay, vagina.
Right now, what bothers you?
I'd rather it be tighter, more virginal looking, and
I don't like.
Well, that is a little unrealistic, okay? Plus, we have videos proving.
I know.
Oh, don't really like that. Don't really like that. Wow. If you didn't laugh, you'd just cry, wouldn't you? I don't like the idea of this word virginal thrown around, but I guess if she wants to have a designer vagina that is tighter and more neat, I guess. I haven't seen a lot of vaginas face to face, shall we just say, but I've seen enough to know that there isn't like a normal vagina. Everyone's is different.
And that's the end of that chapter.
Danielle has the perfect vagina.
Right.
And I want hers. As close as we can get to it.
Oh, I don't know about
So-
that. You wouldn't catch me going into a doctor's office being like, I want her vagina.
Excuse me, bitch.
No, okay. Is she gonna get her pussy out?
I want to have twin vaginas.
I know what a vagina.
I need to leave. I need to go home. I need to leave. Right, come on, Biscuit, let's go. We're leaving. What in the absolute fuckery is happening in here on this day? Right, okay. Pussy flashed in the consultation room, yes.
It's not necessary.
Well, you don't think I should go with that one?
Yeah, it's good. Who does that?
We need to examine.
Yeah,
it.
I feel like that's a bit... No, I don't like that. If as the age-old question goes, if that had happened the other way around, no one in that room would be happy. Right, what's this?
Hello. That's my little medical team. I'm not having the surgeries to better my career. I'm having the surgeries to better myself.
Oh, she looks so pretty without makeup on. Oh, she's got really good skin. Very jealous. At the moment, my skin's an absolute mess.
I don't want people to stare at me on the street. I just want to calm things down.
Okay. You know, the biggest issue with operating on Kimber's nose is the elasticity of the skin.
Yes.
There's not a lot of movement.
Yes.
Now, the thing is, we're not going to hit a home
Finn.
run on this. This is going to be a double or triple.
No Michael Jackson.
No Michael.
Okay.
No, better not be.
I've been to countless amounts of plastic surgeons that have just said...
There's no continuity between the talking head sections. If you notice, she's been in a hat, she's been in full glam, she's been in a boobs out bodysuit, and now she's like, I'm back in the hat.
Absolutely nothing can be done. I'm in complete and utter shock that Dr. Nassif can give me any hope of any improvement.
So let's take a look at the chest area.
Right,
so,
okay, booby time.
you know, the first thing that stands out to me is that they're very large, right?
That stands out to everyone. Yeah.
Right, and you can see the saline bag, the ripples. We call this wrinkling or rippling, right? Yes. So we want to improve that. My plan, if it sounds okay to you, would be I put a smaller pair of silicones in and close up the pocket around them and try to improve the shape. Saline is essentially salt water. It's a water bag. You can feel the water in there. Silicone is a gel-like material that looks and feels like an actual breast. So silicone is almost always preferred in patients.
Yes.
I think that will hit a lot of goals. So
saline is, however, if something goes wrong, saline is considered, how can I say this? It's considered safer as an option in case of like piercing risk, because you'd much rather have salt water leak into your body than an inorganic material such as silicone.
Not least.
Dr. Alter. So I make a little incision here, and here's your clitoris. So if I can cover that up a little bit more like so.
Okay, we're not
it's not as obvious, okay?
The normal anatomy of the vagina is that you have outer lips, inner lips, a clitoris, and a clitoral hood. In Kimber's case, she doesn't have inner lips, nor does she have a clitoral hood. Dr. Alter is going to make her inner lips here and create a clitoral hood.
Oh, she was really
to cover her
botched.
exposed clitoris. This will give her a more natural-appearing female vagina.
So it really sounds like Kimber was actually botched by her genital surgeon. So there are two ways that you can refer to genital surgery. I think now the preferred way is gender confirmation surgeries, but it's also previously known as sexual reassignment surgery. Most trans people will just call it lower surgery.
Oh, Rose, how I do miss the garden.
Are you excited about this plan?
I'm so excited.
Okay.
After I have all these surgeries and I'm fully recovered, I'm gonna go out there and I'm gonna find my simple Southern man, have my 3 children, and call it a day. And you can say goodbye to thee.
Oh dear.
Bye!
Well, I mean, she knows what she wants. I don't know if she's going to be able to get it, but she knows what she wants, and you have to commend her for that, don't you? Yeah! The idea of 3 children sounds vile to me, but there we are. My little biscuit boy is enough. Right, am I going to see any more vaginas?
Well, yes.
Right, here we go, girls.
Is it all recorded? Good, okay. This is my implant flipping backwards.
My name is Renee Talley. My video has been seen in every country in the world. Had, I think it was 1 million views in like 5 minutes.
This is the lady. I know this lady. I've seen this video. Have you seen this video? I don't know if I'm going to be able to put this on YouTube, but like her butt implant spins around inside of her butt. What a horrible sentence that is. I didn't realize that she was going to be on Botched. Oh, how exciting. Oh my gosh. Are they going to be able to help?
I started altering my butt area in 2010. I went through like a little midlife crisis and I wanted the volume and the fullness back at the top of my butt. I did the silicone injections approximately 6 months after I had them done. I started getting sick. I was having really bad fatigue. I had a lot of pain and sensitivity in my butt. I was having stomach issues and bathroom problems.
Silicone
and
injections.
It progressively got worse.
Oh,
They did an MRI to find out where the silicone was, and it had migrated up my back and down my legs, down my thighs, and it can attach to organs and cause autoimmune disease. And that's what happened to me.
That's what happened.
I found a doctor that was willing to do the removal. He had informed me that I would have some deformities where they have to go in and cut out the silicone because they have to cut out the tissue with it.
Yes.
And me being vain, I didn't want that. I decided to put an implant in to fill in the space where the silicone was removed. He wanted me to wait 6 months, and I said no. Immediately after surgery, I noticed there was a problem. I could stick my hand underneath my butt, and I could feel them, which was not comfortable. They had dropped, and I was showing my girlfriend, and I went to pull the implant up, just underneath my cheek, it just flipped. I knew I needed to have it removed, so I found another doctor to take it out. He said,
this is so shocking. This is absolute shocking content. I'm sitting here gobsmacked at this. A lot of this, though, I am going to say is also a little bit of patient error here, because you can't rush healing. That's the one thing, like, fast healing doesn't exist. Your body needs to take as long as it takes to heal. If a doctor is suggesting that you wait 6 months for your body to heal before your next procedure, you better wait, girls.
The doctor should have never put the implant in after removing tissue.
Yes.
When they started having issues, they should have came out.
Unfortunately, just with like any industry, there are always going to be people happy to take your money for a subpar service.
This whole procedure has affected my life in so many different ways. I don't really look in the mirror at myself anymore because I'm not happy with the way my butt looks. Something I did to myself, so I'm gonna have to learn to live with it. I'm probably never gonna be able to fix the imperfection. Once you ruin it, you can't go back and fix it.
Yes, so what's gonna happen next? Oh, what's gonna happen with her booty, girls? Oh, I mean, perfect. Eyelash woman. Right, what's this? Where's that? The Eastern wig. Oh, here we are.
Hi,
Renee's
I'm Renee
consultation.
Talley. I'm here for the doctors.
Oh,
Right.
great. You can sign in.
Renee is
Hello,
a patient
receptionist.
with complicated buttock implant problems.
Yes.
Renee, how are you? Terry Dubrow, nice to meet
This
you.
show is so shocking, isn't it? Like, I don't even think I really need to do any marketing on my Chanel for this show. It's literally just every episode we watch going to be this dramatic the whole time. Just, my mind is sitting here like almost completely blown. We've got a transsexual woman who wants full body work and reconstruction. And then we've got a lady whose bum has gone goodness knows where. It's a lot in the studio today, my lovelies.
Yes, it is.
Shall we continue?
Nice to meet you.
Have a seat.
Yes.
So
Is he gonna give you a
we
brow
know
lift?
you've had a little bit of a complicated history of having a butt.
Biscuit, you are a stinky little fart boy today. Stinky little fart boy biscuit boys.
We know you've had a little bit of a complicated history of having a buttock augmentation. Before
Right.
you had any buttock augmentation done at all, what were
Yes.
you trying to achieve exactly?
I just wanted a little bit more volume on the top.
'Cause the
So
implants
this would have
look
been a
like they
BBL
were giving you
now.
A lot of lower projection.
Yeah, and I didn't really like that. I didn't need that. I had a really nice butt before I ever touched it. It's just I have body dysmorphia.
You think you have body dysmorphia?
Oh, I know I do.
Renee admittedly has a personality disorder where she basically has concerns out of proportion to what she sees in the mirror. And
Isn't that what everyone who goes for cosmetic surgery kind of has a little bit of body dysmorphia, no? That's the whole point plastic surgery exists, no? No? Am I being a little bit ruthless there? I feel like everyone has a little smidge. I don't think anyone in my personal life doesn't have a little smidge of body dysmorphia. Although I do wonder if maybe that's because of all the hateful TV shows we grew up with in the mid-2000s.
Mr. and Mrs. Massive Fatty.
nothing will make her happy. Did the doctors know you had body dysmorphia?
Yes.
Did they send you to a psychologist or psychiatrist first? They just said, okay, we'll do it?
Yeah.
So, as you know, we plastic surgeons prefer not to operate on patients with body dysmorphia disorder. Of course, if a patient has a deformity, even a patient with body dysmorphia disorder is entitled to be normalized. But we want to go in, if it's okay, and have a look and do an examination, see what we think are the options for you.
He says that, but he worked on The Swan, which literally was quoted as taking average ugly ducklings and turning them into the Swan girls. That to me says body dysmorphia. You know, mind you, I have a funny feeling about Dr. Dubrow because he has been involved in like unscrupulous surgical shows before where the boundaries between like what should and shouldn't happen have been quite firmly pushed. 21 plastic surgeries in one go on one patient is just, to me, that's excessive and unnecessary. And obviously springs from something like dysmorphia. Difficult, lemon, difficult. I'm not sure I completely agree with what he said there of like, well, you know, most of the time, no, you've been notesy, you are notesy.
For you, and see what you think about those options.
Right, okay, options.
Do me a favor.
Teleportation.
Stand up. Now, do you mind if I lift this up and show your buttock?
No, it's all over the internet. Go ahead.
Oh, that's a good point, isn't it? Now you have a big mass right here, huh? She had a lot of large inflammatory masses which were consistent with silicone injections into these areas. You have these old pockets
Oh,
with
dear.
scar tissue where the implants were.
She's in a rather precarious position there. Was that necessary? Couldn't they get her to lay down, perhaps? No? Instead of being like, oh, spread the fallopian tube.
Excuse me, bitch?
No, Luxeria, don't put that on the internet. Well, it's too late now.
You have a deep concavity here and
Volume
a lot
loss.
of loose skin. Stand up for a sec. She had scarring
That
and
could have been so
evidence
much
of
more
previous
dignified.
surgical procedures that had gone very wrong. Not to put too fine a point on it, but Renee's buttock has gone to Okay, Paul, would you lift her up again? A buttock lift would be an ideal procedure to
we've not
restore
seen him get out
normal
his
anatomy
camera
and actually
before.
give her a very good looking buttock. Here's your before, and here's after a buttock lift, which to me is a normal buttock.
Right.
The problem we have is someone with body dysmorphia disorder is not going to necessarily be happy going from abnormal to a cosmetically normal situation.
Right.
We never want to end up operating on a person for two reasons. One,
are they gonna say
we're
no?
do harm.
Are they gonna
and
say
two,
no?
We know for sure that we're not going to make them happy. Whatever we do for Renee will not make her happy. To me, the best thing to do would be for you to get a little bit of counseling with that, work on it, get that improved, number one. Then possibly after that, maybe a possibility of doing a lift.
Interesting.
Well, I will follow your instructions.
They're gonna
I need
tell
to
her
obviously
no.
get the psychological help that I need and then worry about the cosmetic later. Thank you guys for your time.
Thank you for coming in.
Interesting.
I think I need to come to the realization that I'm not going to be perfect. And this may not give me the satisfaction that I'm looking for.
Interesting. Oh, what an interesting segment there. I quite like the idea that they aren't just going to operate on everyone. I feel like in every episode, we're probably going to see someone that's like turned away for plastic surgery. But I do want to say one thing that Dr. Dubrow said there was that someone with body dysmorphia still deserves to have what's considered a normal buttock. What they've actually just said here is like, oh, you have this problem. We could fix it, but actually we're not going to. And I feel a little bit like what she's going to be having done is technically reconstructive and not really like cosmetic as such. And cosmetic and reconstructive surgeries are like two branches of the same tree, should we say. But both deserve to have flowers on at the end. So if she was to get a buttock lift and then maybe have like a little bit of fluffing through perhaps like filler, but then she does have silicone, doesn't she? Inflammatory silicone in the area, so maybe she can't get filler because that would cause extra problems. Oh, it just goes to show though, doesn't it, my loves? Don't get back Ali silicone filler. Don't do all that. Never, 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 never. I want to be perfect, girl. Just want to say, I'm actually really enjoying Botched. I know I've got a lot to say about it and a lot of things, a lot of opinions to share, but I'm really enjoying this show in terms of like juice. I've been really wanting to cover something with plastic surgery that's nowhere near as like unethical as the swan or bridal plasty for a long time, and I haven't been able to, so I'm very excited. Are you excited for me to continue the Botched series? Yeah! Oh my goodness, there's some shoes. Dorothy, girls. All right, what's this?
I can't wait to babies.
Oh, not baby shopping.
I love popping in and out of baby stores sometimes. Maybe I'll see something cool and then eventually I'll have a kid and they may not make that 5 or 10 years later. So I found this.
Yeah, but... Oh, I don't know.
If I buy it, even if I don't have a girl or a baby at all, I won't have wasted my money because it fits.
Oh my God.
Is that a baby?
Being a styling.
You are.
I'm gorge, right?
Yeah,
that is a
that's a pretty big baby.
She's tiny. If she can fit into baby
Sometimes
clothes.
I wonder if it'll ever actually happen for
Birth
me.
weight.
Well, I'm big, strong, hardy boys that aren't afraid to wear pink. When I had my surgeries done, I'll feel maybe more myself.
She gives
I
me
won't
very like
feel
housewife vibes.
like a product. Oh, look how cute.
Oh, difficult, lemon,
I know.
difficult.
Should
I
I
hope
have
she
my
gets what she
gestational
wants.
carrier have like twins that way?
That is a very loud coat, isn't it? I've only just noticed. Very loud. What is that? That's not leopard, is it? Is that cheetah? Yes, I am! Oh, we've got another bob. The bob was very popular.
It's just, I'm saving time.
Yeah.
And I can get like a double.
I wonder if
I don't
she
think
ever
you'd be
did
able to
have
handle 2 babies at
3
once,
strong
though.
boys.
I'd have nannies.
Let's hope so. I can just see you pulling your hair out right about now.
I want to come off the way that I feel on the inside. Maybe that'll help me find the right man and get myself more in a position to be where I want to be in life.
Oh, I do want to say, though, don't get plastic surgery for men, please. I feel like we see a lot of this on these sorts of shows where someone kind of feels like if they get a certain something done, other people will like them more, or something like that. I do feel like, do not get plastic surgery for a man. Don't do that. Don't do that. You're just opening up
back here again,
problems.
I'm sure. Hopefully.
Right, okay. Oh, the baby section's over now. Do you think production literally just said, oh my God, Kimber, get ready. We're gonna take you to a baby shop. Babies. And yes, trans people can have kids. Shopping is my cardio.
Okay,
Oh,
great. You can sign in and we'll take you back shortly.
All right.
Okay.
I'm feeling a little anxious.
All of the
Today I'm
blondes are
having
here.
3 surgeries. I'm having a revisional
Wait, she's
rhinoplasty,
she
my
having them all
breast
done at the same
reduced, and I'm having a labiaplasty.
Your boobs, I feel like they change
Not
all the time. I can never
3
tell
surgeries.
if they're up or down. I know they're huge.
Even when you think they're small, they're big.
Well, I don't think they're small right now.
I know, thank God.
I can't wait till they go down a little bit.
How much smaller are you getting?
200 cc's. After I have all these surgeries and I'm fully
For
recovered.
context, I have breast implants. Mine are 375 on each side. So in total, I have 750 cc's, but she's saying that she has 1,000 cc's, and I think they're actually in each breast, so I think she probably has 2,000 cc's. Having them reduced down to 800 is still a considerably larger size.
I won't look in the mirror every day and think, what did I do to myself? I have to go down gradually because if I go down too much, I'll shock myself. And you know me, I'll be like, oh, and then I'll go get bigger again.
I know, and that's the last thing we want.
Right.
That's
Ease your way into
dysphoria.
Right.
Kimber?
Right.
Hi. My name is Ozzy. I'm going to be your nurse today. Okay, I'm going to take you back.
All right.
Gosh, all these piercing blue eyes. Right, off we go. She's going into surgery. See you all later. I can't believe she's getting all 3 done at once. That's crazy. Surgery, girls! Right, here we go.
Yes. What do you want to do with them?
Sell them.
You want to sell them? What, on eBay?
No, my website.
Oh, really?
Yeah, they bought my last set.
What'd they buy them for?
5,000.
5,000? Wow.
Sell your old implants?
Not a bad idea.
Is
There
that
may
even
be a
allowed?
side business there for us.
Count back from 10.
I'm going to start by reducing
10,
Kimber's breast
9.
from her large 1,000cc implants to a much more modest 800cc's.
Okay.
Then Dr. Nassif is going to use skin and cartilage from Kimber's ear to lengthen her nose. Finally, Dr. Alter is going to reshape Kimber's vagina to give her a much more natural.
Okay, right, booby time.
You don't want to get any bacteria around those implants for fear of an infection.
He hasn't
These
said if he's going to go
implants
under
are
the
so
muscle or
big
not.
that given time, they can easily wear their way through the skin. Biggest problem that I might face with Kimber's breast is that her skin is very thin. Therefore, the blood supply to the nipple isn't very good. When the blood supply to the nipple is impaired, it undergoes a process called necrosis. It just dies and falls off.
Well, that's
not a
scary.
good situation.
No.
It's basically zombie breasts. Okay, we're gonna
It's not zombie
start
breasts.
by taking out these implants. Look, these implants are upside down.
Okay, they're going.
Get the suction
They're
on.
upside down.
Look at this. So. Whoa.
Oh my goodness.
So that's what she's basically skin on chest wall. So it's supposed to be like this.
I am absolutely gagged with what I've just seen. So it looks like Kimber's breast tissue is practically non-existent, and she's just had silicone straight under skin to look really like booby. Maybe she doesn't have that muscle, or maybe something else has happened there. No, she can't not have a pectoral muscle, surely. My goodness. Right, okay. Boobs!
She was like this. So she was like this. So this is also an 800cc implant that's been overinflated.
Interesting. She has no
breast
chest fat at all.
No chest fat, no breast tissue, nothing.
She has no breast
because
tissue.
she was formerly a man. you don't have the usual kind of coverage you do over the implant.
That's not true. I'm going to completely disagree there. I had mine done under the muscle. I had sufficient breast tissue growth already. Just because someone is trans does not necessarily mean that they will never have breast tissue. No. I thought a doctor would have known that.
I'm going to take a piece of skin and cartilage from the ear, which will be used to line the inside of the nostrils. Essentially, that will just lower the nostrils.
I'm just so shocked they're doing this all at the same time.
Her nostrils were lifted up too much. You can see inside of her nose. And she had tight nasal skin. So I did not know if I was going to be able to extend her nose. So this is the composite graft. It's made out of skin on this side, cartilage on this side.
Hang on, if you don't know, but you haven't opened up the nose already to look, and you're already cutting part out of the ear, doesn't that mean no? Oh, I don't know. Oh, shocking, girls!
And this will be used to align the inside of her nostrils.
Paul, what are you doing now?
I took a composite graft from the left ear.
Because her skin is so thin, and it shows what we call rippling through the skin, where you can actually see the folds of the implant, we're going to sew in a piece of mesh to reinforce the skin.
Wow. That's crazy. Reinforce the skin with some mesh.
They look remarkable. You did an amazing job.
Thank you. With time, tissue will grow in and thicken up this skin and make these better, safer breasts to have. I think they're smaller, they're reinforced, they're safer.
Oh, his microphone's turned off.
You should be really happy.
And now we're trying to lengthen Kimber's nose through a closed technique. I'm going through a lot of scar tissue. You know, since I wasn't doing a lot of work up in the middle part of the nose or around the tip, I did not have to do an open rhinoplasty, which means only the incisions are made inside the nose.
Inside the nose?
There's no visible external scar.
I've never seen that
Dr.
before.
Alter.
I've never seen a non, what do you call it? Like a non-open rhinoplasty. I've never seen that. Wow. Okay, so he's taking some cartilage from the ear and he's going to like build a new... This isn't the bridge. Is this the bridge? This part's the bridge. What's this part called? Oh no, what's this part called? I guess lower bridge, upper tip. He's going to build a new one of those.
How's it going down there?
Going great. Kimber's clitoris had too much of her clitoris showing.
And also vaginoplasty at the same
the
time.
length of her clitoral hood so that it covered more of her clitoris, which will make her look much more normal.
Okay.
She'll still be able to get access, so it's not going to interfere at all with sensation.
Okay, guys, we're finished.
I don't know if cis people know this, but typical male and female genitals are made from the same thing within the womb. At one point in gestation, before like splitting took effect, every person on this planet was technically, at one point, female in the womb.
My pussy pops severely.
And then this part that could be considered the clitoris splits into two if the fetus develops typical male into the tip of the helmet and the prostate. So in fact, this genital conformation is in fact interchangeable.
Why you mad?
I was able to improve and lengthen her nostrils, but by no means are they perfectly symmetric. Dr. Alter?
Oh no, is she gonna hate that? I want to be perfect, girls! I've got it! Watching these kinds of shows does alter my idea of what I want for surgery in the future, because currently I'm very much of the opinion of like, done for now, don't want anything. I'm not looking to rush into any other decisions. If something comes up that I really want to sit on and think about for about 6 months to a year, maybe then, you never know. But as of right now, I don't need to touch anything, and these shows are reinforcing it to me that I do not need to touch anything. I want to be beautiful. All right, Kimber's day one check-in.
I'm a bit surprised how sore I am. Even after I had a sex change, I was at the mall and getting my hair and nails done 3 days later.
No.
And I can't even imagine doing any of those right now. Hi.
We're here.
No, I don't think that's correct.
How are you?
Thank you.
Good, how are you?
Oh, she's in a dark room.
Sore where?
Where?
My breasts are still sore.
They are sore. Well, let me tell you what I did. I started on the right, and I went down to the implant. The first thing I found was the implant was upside down.
Crazy.
I kid you not. Completely upside down. It flipped. Yeah. You had 800 cc saline.
When did it flip, though? How could it have flipped?
Overfilled to over 1,000. Yeah. With the right one upside down.
Oh, only one was upside down.
Yeah.
Okay.
I knew something was up.
Yeah. Just want to see a quick look at my incisions. to make, see this mark? That's where I sewed in the mesh.
I can't see anything.
You obviously are not bleeding. Everything's
I
looking
really
okay.
like her hairline.
All
That's
right.
so pretty.
Everything, thank goodness, looks absolutely perfect. And you look great. She wanted a more natural look, and I think we did it.
Oh, I really want to see some afters.
Oldies.
They're clean and intact.
I'm thinking
Oh, is
about
this her
sending
old
them to my
implants?
ex-boyfriend that wanted me to get them that large and say, you like these better than I did, so you can have them back.
See you very soon, okay?
Okay.
Goodbye.
Icon behavior. Send them back to your ex-boyfriend. Bye, bitch. Right, I want to be perfect, girls. Right, okay.
Hello,
what's this?
Kimber.
Hey,
Janet, good to see you, my love.
3-week check-in.
Just
Okay.
kind of-
Right, we've got some afters.
Over the last 3 weeks, the doctors have been keeping a very close eye on me. I've been seeing them all weekly. Dr. Dubrow probably more than weekly, but maybe I spend a little bit more time there than I need to. But
My camera went out of focus then. I know she's not healed just yet, but her nostrils are very uneven currently. Right, I need more information about this. Have we just seen someone be watched on Botched?
I'm good.
Hi, Kimber.
Hello.
So I'm gonna take out the tape, and let me look at this. Okay. All right, so your tip is not bad at all. Okay, I don't see much swelling.
Right.
All right, so we dropped your tip about 5 millimeters, by the way.
5 minutes, half a
You nailed
centimeter.
it.
That's
great.
Thank you, thank you, thank you. Overall, though, the profile, the tip looks perfect.
They exceeded expectations. Before my nose surgery, my nose was flat against.
Actually, that is quite impressive, isn't it? I still think something like this could have been sort of achieved with filler. Something a little bit more along the lines of what she wanted. But maybe, were filler rhinoplasties even a thing back in 2014? I don't even know.
And now my nose is perfect, and you can't see my brains.
Oh, she's got a twitch. Oh no, did you see that? A little twitch.
Perfect.
Twitchy
And you
lip. Oh no, oh no, oh
Can't
no.
see my brains.
How do your breasts feel?
They didn't talk at all about, oh, I don't know, you know. I'm gonna have to look up Kimber afterwards. If Kimber's watching, I would love to interview you about your experience on Botched.
They don't hurt.
Boy, they're so much better, smaller like this, aren't
So
they?
much better.
They look so much better, yeah.
I feel
She
like
does have a
myself
line,
again.
though.
Really?
She does
Yeah,
have a
I
line.
don't feel like a character anymore. Before, my breasts were ridiculous. Hard as a rock, they didn't move.
They were also very uneven, very, like, not filled correctly for evenness. They do look really good now. They are still very large, I would say.
Now they're the perfect size, 32 triple D.
So you still
Triple
think,
D?
ideally, these are still a little big?
I think for right now, the stage in my life, they're good.
They're perfect.
But I definitely see myself going down in a couple years to probably like a D.
Kimber looks fantastic.
That's what
she
I
was
know.
hoping for a more natural looking result, and I think what we've done will go a long way towards achieving that goal.
Yes.
Okay, so I need to see you in stirrups, okay?
Right, okay.
My
Did we need that? Did that need to happen? That is bonkers. The idea that an editor's like, and the angels have arrived. Wow. Okay, she is in a sensible gingham daytime heel for the stirrups, though. Sure.
vagina
Turn the party.
is looking gorgeous.
Okay. Oh my goodness.
Convexity here
I feel like
instead
this
of
is far too
concavity.
intimate.
See, there's your clitoris in there. This is going to continue to soften up and become even more...
Oh, I need an adult. This is far too... That was far too adult. Far too adult for my little eyes. Far too adult.
So quickly because it's used to the pounding. You did amazing.
This is so adult. I'm going to have to cut 90% of this episode.
Like less pornified. I feel like myself.
Oh.
Try hard, scene 3 beta, take 2.
I'm definitely ready to exit porn. So after this last video I'm in, I just want to be done.
Yeah.
My threesome of doctors properly gangbanged me and gave me just a perfect outcome.
So you're happy then?
I'm happy.
Wow! My goodness me. That last couple of minutes, my loves.
Time for a brow lift.
I just don't have any words for today's episode, my lovelies. I feel like I've said everything I want to say during this episode so far. Okay, I just want to say though, whenever a trans person's journey is involved on any of these shows, it is always painted as the most extreme, like, journey that one can undertake. It is a pretty intense journey to be trans. anyone trans in the audience here will understand exactly what I mean when I say that. I do, however, feel like at the end there, Kimber's nostril was botched. I do feel like it was botched on botched. I feel like we watched Dr. Paul Nassif botch someone, you know? I'm gonna have to look up Kimber after this because I need to know what happened with the nostrils there. Again, I do want to say though, in this episode, we've seen this kind of like back and forwards between the surgeons that feels very unprofessional, and I feel like they almost verge into areas sometimes where they try and make like an adult joke that just kind of, to me, if someone made that joke to me, I'd feel like, this is really unprofessional and I probably won't go to you if you've made that kind of a joke in the consultation. Maybe because they're on TV, it's kind of amped up for this like reality TV drama situation. Maybe also the patients are okay with making these kinds of jokes because they do work in the adult industry, and I guess you can kind of joke about your industry if you're in that industry, you know, like, you know, the ins and outs. Oh, pardon the pun. Very interesting that we did see another patient turned away. As I said earlier, I'm pretty sure that in every episode we're probably going to see someone get turned away for plastic surgery. However, I do feel like the way that they handled that was very interesting because Dr. Dubrow specifically has a history of working in shows that are unethical with plastic surgery. So it's interesting that he brought up the idea of ethics and saying it's unethical for a plastic surgeon to operate on someone with body dysmorphia, even though that's his whole career. Well, my lovelies, let me know what you think about what we've seen in today's episode of Botched, because goodness me, what an episode. I can't wait for the next one. Is it going to be bonkers every single time? And with that, my loves, it's time for the Patreons. You can see yourself scrolling past on the screen right here. Yes, you can. Hello, Mr. Biscuits. Did you enjoy your little pillow moment? He's folding his arms in a really funny way. Oh, little Biscuit, good boy. You wanted a cuddle? You can have a cuddle. We've got lots of cuddles in stock for you. Today's Instagram shout out goes to Fairy Gothmother. Thank you so much for following me over on Instagram, you stunning woman on the go. And if you want to be in with a chance of being featured in my next video's Instagram shout out, make sure you go and follow me over on Instagram. It is Luxeria, and I post all my fashion and travel content over there. Thank you, Biscuit. Thank you for the kisses. And once again, I want to say a massive thank you to my top tier Patreons: Alex Ewart Official, Orkos Samoji, Ari Adia X, Becky Johnson, Beebles32, Cameron Pittman, Shell Herman, Christina Kyle, ContraPoints, Elizabeth Stone, Emily Worsham, Eric Castillo, Finch Dunham, Hannah Ruth, Jen Martin, Caitlin Wright, Larissa Says Relax, Leanne Jones, Les Banana, Min Min TM, Mariah Sherman, Miss Kiss, Novembrix, Paula Rivera, Ryan Loves Rory, Steffutek, Taylor Martin, and Vicky Walsh. And you know what, my loves? I'm going to leave it on the note of, if you're going to go for a plastic surgery consultation, always get more than one opinion. Always. And with that, I'll see you in the next one. Yes, Biscuit?
Yeah,